Abdominal pain is a common problem in children. 5% of preschool children and 25% of children aged between 7 and 12 experience abdominal pain. In 1% of patients, abdominal pain is caused by a condition that requires surgical intervention. If abdominal pain is accompanied by symptoms such as vomiting, blood in the stool, weight loss, fever, or rash, you should definitely consult your doctor. If abdominal pain lasts longer than 6 hours, becomes increasingly severe, there is a feeling of heaviness in a specific area of the abdomen, or if there is bile-stained vomiting, then the child should be taken to the emergency department and assessed by a pediatric surgeon. The cause of abdominal pain may be a condition that requires surgery, such as appendicitis or an intestinal obstruction. There are many causes of abdominal pain. Intestinal infections, constipation, food poisoning, urinary tract infections, gastritis, ulcers, ovulation pain in adolescents, and gallstones are important causes of abdominal pain. Some rheumatic diseases, such as familial Mediterranean fever, can also cause abdominal pain. To determine the cause of abdominal pain, blood tests, urine and stool tests, and intestinal X-rays may be performed. In cases where a diagnosis cannot be made with these, contrast intestinal films and endoscopy may be necessary. The treatment of abdominal pain should be based on the underlying cause. If the cause of abdominal pain is intestinal infections, these are usually due to viruses. Diarrhea may occur along with abdominal pain. In this case, it will be beneficial to replace lost fluids and salts, administer probiotics, and follow a diarrhea diet. If the cause of abdominal pain is gastritis or an ulcer, medications that control stomach acid and dietary management will be appropriate treatment methods. If the cause of abdominal pain is rheumatic diseases, it can be brought under control with medication prescribed by a specialist doctor. If abdominal pain is caused by a surgical condition such as appendicitis or intestinal obstruction, then an operation will be necessary to resolve the problem. Since abdominal pain can sometimes be a sign of serious illnesses, the child's complaints should be carefully observed, investigated for additional symptoms, and one should not delay in consulting a doctor.